Welcome, Dr. Andy Mendenhall, Chief Executive of Central City Concern. I am so grateful to be here with you and to learn more about the great work that you lead and do for our great city of Portland and state in Oregon. I've had the privilege of getting to join forces with you through both of our organizations, Providence Health Plan and Central City, and I wanted everyone else to have an opportunity to experience and see through your eyes all of the great work that you're leading and doing for our community.
Central City Concern is a 45-year-old Portland-based community nonprofit that started off in the world of affordable housing and offering folks an opportunity to get off the street, typically if they had a severe substance use disorder or mental health challenge, and have the opportunity to get housed, have some supportive services, and most importantly, connect and engage in community. Over the last 45 years, we've grown and added healthcare services. We've started to provide employment and supportive employment services. And last year in the Multnomah County and Clackamas County region, we served more than 16,000 individuals. We know that there's an extremely high trauma burden with family histories of poverty, family histories of having unmet social determinant needs.
You mentioned social determinants of health. In the healthcare space, I think we're used to hearing that terminology and talking about that concept, but I would just love it if you could expand a little bit on when we say social determinants of health, what do we mean by that, and why does it even really matter?
As a family physician by my original training, social determinants of health have always been a factor in the background of our thinking. And what social determinants of health are is they're non-medical factors that influence health outcomes. And so these are things like food, housing. These are things like connection and community. We have folks, unfortunately, that we serve that struggle to even store their medications for the treatment of their diabetes. An example would be the need to refrigerate insulin. Lastly, I mentioned community. It's so important for folks to be connected in community. We're social creatures. We evolve that way. And I think most importantly, when folks have connection, when they know that individuals have somebody that's looking out for them or have a reason, quite frankly, to take better care of themselves, all of these are factors in helping people do better and have improved health outcomes. At the end of the day, I'm really excited about the work that Providence Health Plan is doing, and I'm excited about the dialogue that we're having in the healthcare sphere in general about doing really important things that make people's lives better, again, that drive better health outcomes, and guess what? Save healthcare dollars, allowing dollars to go further to make an impact and create value for our communities and value for other stakeholders.
1 year ago, we joined forces in our initiative for Health for All to amplify the great work that you're already doing. And so I would just love to hear any stories that you could share with us since our partnership that's been more focused over the past year.
So thanks to the support of Providence Health Plan, we've been able to invest dollars and robustly grow our opioid overdose response program to support access to the overdose reversal product, Naloxone. And we have been able to put Naloxone in all of our housing programs. We know that literally every week a life is being saved, and those are lives worth saving, and those are lives that we can then help get plugged back into programming, help those individuals preserve their housing, not end up back homeless most of the time, and get back into recovery. In America in particular, there's been so much stigma associated with both substance use disorder and behavioral health, mental illness challenges, if you will. And what we need to be doing as a society is recognizing that 1 in 4 American families today has a person who's struggling with some form of substance use disorder, and that those individuals, meaning those families as well, deserve to get healthy. We need to change the dialogue. We need to change the equation. We know that recovery is possible. We know that through allowing people to feel loved, cared for, to have the experience, strength, and hope of the individuals that have gone through our programming that then work for us. We see that magic happening, and our hope is to continue to carry that message forward and to amplify our ability to impact both our communities, but also demonstrate a model that we know drives outcome, saves money, saves lives, improves community, and should be duplicated in other parts of the country.
Well, thank you so much for your time today, Dr. Mendenhall. Thank you to all of our viewers. We really appreciate you taking the time to tune in and to be with us and hear about all of the great work that Central City Concern has been doing and continues to do.